Question 1. A 26-year-old primigravida at 10 weeks gestation presents with painless vaginal bleeding. Ultrasound shows a bunch of grapes appearance. What is the most likely diagnosis? The most accurate answer is C. Molar pregnancy. A grape-like vesicular mass with painless bleeding in early pregnancy is classic for hydatidiform mole. Question 2. A 30-year-old woman at 36 weeks presents with painless vaginal bleeding. Uterus is soft and non-tender. What is the most likely diagnosis? The correct option is B. Placenta previa. Painless third trimester bleeding with soft uterus is classic for placenta previa. Question 3. A pregnant woman at 28 weeks presents with elevated blood pressure and tonic-clonic seizures. Which one is the immediate drug of choice? The preferred treatment option is C. Magnesium sulfate. Magnesium sulfate is the drug of choice, while the others are not first-line in eclamptic seizures. Question 4. A 32-week gravida with no previous hypertension now has BP 160 over 110 millimeters of mercury, complaints of headache, and marked proteinuria on urine testing. What is the most likely diagnosis? The most likely diagnosis is C. Preeclampsia. Hypertension with proteinuria after 20 weeks of gestation defines preeclampsia. Question 5. A 24-year-old woman presents with amenorrhea, lower abdominal pain, and spotting. Her pregnancy test is positive, but transvaginal ultrasound reveals an empty uterus. What is the most likely diagnosis? The best supported option is B. Ectopic pregnancy. Amenorrhea, pain, spotting with positive pregnancy test, and empty uterus transvaginal ultrasound is classic for ectopic pregnancy. Question 6. A woman at 10 weeks of pregnancy presents with vaginal bleeding and passage of tissue. On examination, the cervix is closed, and ultrasound shows an empty uterus. What is the most likely diagnosis? The right choice is D. Complete abortion. A complete abortion occurs when all products of conception are expelled and the uterus appears empty on ultrasound. Question 7. A 28-year-old woman in labor has fetal heart rate decelerations that begin with each contraction and return to baseline as the contraction ends. What type of deceleration is this? The best answer is A. Early decelerations. Early decelerations are benign and caused by fetal head compression.